several European countries have issued new restrictions to curb the spread of the virus as COVID-19 cases spike. Reactions from the public, however, seem to be mixed. Not everyone welcomes the new restrictions, as previous measures have hit some economies hard, resulting in job losses and slashed paychecks. In London, protesters took to the streets over the week, holding signs saying, "Lockdown kills and COVID-19 equals control." Where is the balance between saving lives and saving livelihoods, not only in the EU but in other areas where COVID-19 still poses a grave concern? Knowing what we know now in terms of fighting the virus, how to brace for the winter months ahead. Joining me for the discussion from Rome is Francesco Sisci, Senior Researcher at the Center for European Studies at Renmin University. From New York City, Max Wolff, Chief Economist at iCash Group. And in Beijing, Wang Cong, Chief Reporter for the Global Times. Welcome, gentlemen. Let me go to you first, Francesco. Last week, after Italy recorded over 11,000 new cases on October the 18th, the highest daily count the country has seen, Italian authorities declared new measures, including an end to parties and non-professional football matches. Thank God we still have Serie A. What have been the reactions from the general public towards the new measures?
Well, as you said, it's been quite mixed because, one, there is a kind of fatigue for the lockdown. People are tired, and then people find themselves safer. Now there is some kind of cure, there is a treatment, and so people feel that they can anyway survive the virus. But most importantly, as you also said, there is the fear of losing money and losing their job. Now, most of the Italians have gone by through paychecks given by the government, but we all know that the government cannot pay those paychecks, those salaries, those furloughs forever. So people fear that if a new lockdown, even if a limited lockdown will be moved in, people will lose their money, their jobs, and there is a chance. I mean, what do? Do you starve, or you risk your life through virus? And of course, you risk your life is the immediate answer.
Well, that is a true dilemma. We're so sorry for those folks who have to go between those two tough choices. Let me go to you, Max, in New York City. Earlier last week, British Prime Minister Boris Johnson rolled out a three-tier system with increasing restrictions depending on the designated alert level. Thousands of British people took to the streets, with some holding signs saying, "Question the government narrative, rise up now," or signs like "Freedom of speech is our right, COVID-19 is a hoax, lockdown kills." Are the British people, or at least those protesters, overreacting?
I don't know if they're overreacting. There's a lot of disinformation, some of it quite organized here. And there's also attempts by some of the governments in Europe and the US where the response has been grossly inadequate and grossly incompetent to say there's something going on other than the gross incompetence of the leadership killing tens, or in our case here in the US, hundreds of thousands of people. And I think the dichotomy between an economy that's robust and public health is always a false dichotomy. And I think there are places we can learn from. I think if South Korea, Singapore, China have done a pretty good job, and the reward of managing the virus better is actually having a better economy. We look at a nearly 5% GDP print from China pretty recently, and good numbers from South Korea and from Vietnam, other places that have managed this well. It turns out that managing the public health crisis well also allows the economy to grow. So this dichotomy, this notion that either you let everyone go out and die and bring things home that kill their relatives, or you have a robust economy, is simply both nasty and false. But there are folks invested in that narrative around the world, and they find willing audiences in any group that's been traumatized and or misled by their government. And unfortunately, Western Europe and the United States have a lot of people in that circumstance right now.
Well, Wang Cong, what do you think? Do you also agree with Max, whereby he said it is a false choice between public health and a great economy or economic recovery?
I think when it comes to this second wave in Europe and in the United States, that very discussion, that dilemma between the two opposing opinions is the danger, actually, because having discussions over whether we should have lockdown measures or testing or contact tracing, these have impact on the decision-making process and also the measures to actually stop the virus itself because of these protests and these different opinions. And those have very dangerous results for lives. I mean, when it comes to containing the virus, there are two fronts, right? First is the protecting lives, and second is the livelihood. And as Max just said, I think you cannot protect the livelihood without protecting the lives first. And what we can see from China, I mean, we just saw the numbers, the GDP numbers for the third quarter, and the numbers are very, very encouraging. But we cannot just see the headline numbers. We should also see how China contains resurgence of the virus. Just over the weekend, I mean, within 5 days, Qingdao tested 11 million people. Contact tracing is still very much going on, very effective. I don't know why people are still discussing about all these measures, because lives are at risk, and without lives, I think livelihood is also off the table. So it's really appalling, and you know, for me to see all these discussions still going on as we see record numbers in cases and also death rising rapidly.
Francesco, in Rome, Italy, what do you think? Do you agree with Wang Cong?
Well, definitely there is incompetence, definitely in many countries. I don't want to point fingers because I think there is plenty of guilt to be spread around about incompetence. Government incompetence, slow, tardiness, yes, definitely here. But we must also see that besides the incompetence, there is also a social reaction. I mean, in Asia, I mean, not only China, but Korea, Japan, other Asian countries, people are willing to accept some form of, let's put it in a straight way, social control in return
Sacrifice,
for security, for safety. Yes, you know, freedom, privacy, I wouldn't say freedom, but at least lack of privacy for security, for safety. However, this social contract is much more difficult to pan out in other Western countries. In Germany, also Northern European countries, they managed, and I think in some countries they are doing quite well, but also because the healthcare system is much more solid, is more public. In different countries like, I would say, Britain, United States, and perhaps also Italy, society is much looser, harder to organize, plus there is the incompetence. So it's a different mix. I would look also at the social fabric. People are really reluctant to give up their personal privacy in return for the promise of safety.
Right. Max, you know, according to the IMF, the UK is forecast to see a GDP decline by over 10% this year. The US, on a lesser extent, we also see a major decline. Do you think it's safe to say that without acute pain of locking down cities, quarantining most, if not all of your citizens, like many Asian societies have done, there will be chronic and long-term suffering, both in economic and public health terms?
Yeah, so
yes,
unfortunately, I think
Max,
so.
please go ahead.
Sorry.
Francesco,
Sorry,
this
yeah.
question is to Max, please.
So yeah, I think unfortunately for the U.S. here, you know, we are past the point of solving major economic damage and loss of life. Both are guaranteed. We probably already have 250,000 lives lost here, and we definitely have, you know, 6-7 million infections with a very low testing base, and with some odd features, let's say, about how we've collected those death tolls, probably quite a bit higher. So I think unfortunately now that we've seen 50,000 plus cases day after day around the country with hotspots, I do think that Americans mostly believe in a false dichotomy. A lot of people do, a lot of people don't. I think where the government has been more competent here, there's signs of hope. So I'm from New York, and in New York, we've actually been pretty aggressive. We've mostly copied policies from Northeast Asia that have worked there and Northern Europe, and we've done a pretty good job. So we actually don't have as much of an economic lockdown now, although we had one then, but we have much economic suffering, and that's to do also with the way the American economy is set up, where personal services are an enormous part of the U.S. economy, right? And so obviously personal services are hit particularly hard. The only thing I would tell you is Americans are really happy to give up their personal liberty and privacy in exchange for free photo sharing and dating apps. So I think it's a little bit deeper problem. I think it's about whether or not they trust the government, because having made a lot of my life in the internet economy, people will give up every piece of privacy they've ever had in order to send their photos to be reviewed by complete strangers. And some could make the argument that public health could be even more important than sharing hundreds of pictures of macaroni and cheese.
Well, some would definitely argue that. Thomas Friedman published an article in the New York Times. He called that China got better, we got sicker, thanks Trump. Obviously, he holds Trump accountable for his negligence, in handling the coronavirus. So, Wang Cong, let me ask you this. In reality, do you think it is a war, or do you think most Chinese people see it as a war to see which country has less or more casualties? How do the Chinese people look at the situation in America right now?
No, I don't. I mean, from my interactions with, my friends and most people in China, there's no one is, comparing who has more deaths. And, it's not a comparison, because people's lives are losing. And I want to add to what Francesca said, respond to what Francesca said. This debate about whether the Western society can have this testing and contact tracing, and that because of different social values that they cannot have, I think it's absolutely false. I think what's the biggest difference is in China, the leaders, the officials articulate what they're trying to do with those measures, the intentions, the objectives is to save lives. However, what's happening in Western society is that they're always politicizing every single issue, even if it's about saving people's lives. And when the national leaders and the mainstream media, the society leaders did not articulate those dangers and what efforts are necessary to the ordinary public, what's that done is creating a void for these always political forces to come in and to step in and take advantage. And that's what's happening. That's what's happening in the U.S., in Italy. I think Max just said it very well, that in U.S., in some sites, people are, easy to give up their information. And also, don't be naive that the government doesn't have all this information. It's not about we're giving up in China, we're giving up our privacy for lives. It's, it's just simple that it has to be done, and they're not tracing that for some other political reasons. It's for public health. So I think as soon as they finish this, and the national leaders in the Western society to articulate this and say it can be done, I think the discussions, the dilemma, and the delays will continue, and that's not good for the life, the public health, and also the economy.
Yeah. I think people are already looking beyond November the 3rd, actually. Many thanks to our guest, Francesco Sisci, Senior Researcher at the Center for European Studies at Renmin University, Max Wolff, Chief Economist at iCash Group, and Wang Cong, Chief Reporter at Global Times. With that, we come to the end of this edition of The Point. As always, follow us on Facebook and Twitter using the handle Liu Xing in Beijing. Thank you for watching. I'm Wang Guan in Beijing.